One of the most common injuries in sports is an ACL injury, the anterior cruciate ligament of the knee. Now, a lot of those are going to need surgery, but we want to show you some exercises you can do to get started on the road to recovery. I'm Dr. David Gege, orthopedic surgeon and sports medicine specialist, here with my friend and physical therapist at Made to Move Physical Therapy, Yves Gege. ACL injuries very often are going to end up needing surgery. Your knee's unstable and it's difficult to land from a jump or plant your foot to change directions. But before you get to the surgery point, you need to do some things to get your knee motion better and get your strength better. And just waiting isn't really an effective strategy to do it. So Yves going to show us some simple things that we can do to get our knee bending and going straight and to get some of that strength back, whether or not you're going to ultimately have surgery.
Yeah, that's such a big important part because we know when a patient goes in for surgery, they need to have really good range of motion before you'll even see them,
Absolutely.
Right? So we want to focus first and foremost on getting as much bending and straightening that knee first. So we're going to work on the straightening piece first.
Perfect.
It's one of our favorite exercises. So we're going to use just a simple band here. You can purchase one from Dick's Sporting Goods, Amazon, tie it to something stable, right, to make sure. And we're actually going to put our knee inside of it.
Tell you what, shoes off.
There you go.
Okay, so foot
in there, yep. And we're going to put it just on the back side of our knee and walk back till we feel just a little bit of tension. Perfect. And usually, right, this is about where the knee almost feels comfortable for a lot of our patients. And then we're going to push into the band and just try to straighten our knee as much as we can. A little discomfort's okay, right? We're allowed to push through this stuff, especially if we're trying to work towards getting full range of motion. And you'll just rock back and forth. You really feel that quad muscle tighten. And I really want them to push through their heel and get that knee as straight as possible.
Okay.
How's that feel?
Yeah, no, it's good.
Yeah, doing anywhere from 10, maybe 20 reps, 2 to 3 sets should do the trick.
And with after an ACL injury, your knee may be swollen. It's certainly going to be painful. So there's a progression. You might not expect to be able to hit that many right off the beginning, but keep at it and it'll come pretty quickly. I like that a lot. Very good.
Cool. So the next one, we know we get a lot of quad atrophy after these surgeries. So we want to go in with as much strength, and as much quad muscle as we can. So what's the best exercise? Squatting, right?
Okay.
Really, really simple. So we'll just show a basic squat here today.
Terrific.
So we're actually going to just keep our feet about shoulder length apart, maybe a little bit wider, just depending on what your comfort level is.
Right. I'll do this one with you. Since you're facing forward, I'll do it a little bit. I'll do it from the side.
There you go,
yeah. See it both ways.
Dynamic duo. Okay, so we're gonna send our hips back and hands out in front of us and squat as low as we can comfortably and then come back up. Good. You'll do any, go ahead.
And I think doing both legs, some people talk about single leg, but when you've got an unstable knee, you probably want to use both at first to provide you some stability. This isn't about getting strong, like big, bulky strong. This is just getting those quads to fire. Your quads really shut down after an ACL injury, so just even simple squatting can be very, very important, I think.
No, 100%. And I think you bring up a good point. Even sometimes you might be actually loading the side that wasn't injured a lot, and we definitely want to keep the weight as even as possible between both legs. So maybe look in the mirror and just make sure that you're, as long as it's comfortable, slowly progressing to the point where they're even on both legs.
Okay, terrific. Anything else that we should go over, or is that?
Yeah, let's do one more. The other one is bending the knee.
Okay.
Right? Like we've seen a lot of people where they just get not stuck here, but have a lot of trouble getting that bending back. So as much bending as you can get before surgery, we know those outcomes are going to be a little bit better. So we're actually going to get on the floor, right, and try to work on our bending. This is the easiest way to do it. If for some reason your knees may be a little bit uncomfortable with the pressure, feel free to use a pillow or something to make it a little more comfortable. So once we're in this position, we're actually going to send our hips back and slowly, we're just going to rock back here, slowly get more bending in the knee. You can see that here, this angle is starting to close down, and you're going to push as far back as you can, as long as you don't have any pain or discomfort.
Now, again, if you just did this, 2-3 days ago, even maybe in a week, you may only get to 90, but really try to get, a little bit at a time, as Yves mentioned. You don't necessarily, I would argue, need to even get to your heels, but you've got to get past 90, get to 100, 110, 120.
Yep.
Because that makes Surgery, much lower risk of complications. One of the challenges after an ACL surgery is that the knee gets really stiff. It's called arthrofibrosis. If you go into surgery with good motion, your knee easily straightens and bends, that risk drops a ton. So this is critically important. Again, it may not come back instantly, but a little bit at a time go a long way.
Yeah, absolutely.
That's really helpful. So again, whether or not you need surgery or you're trying to avoid surgery and you just want to get started, these are great 3 exercises to kind of get you there. Check Yves out on social media. The links are in the description below. All kinds of helpful physical therapy, injury prevention, rehab information. Look for more of these videos. We got more coming. Thank you so much for watching.